When you have narrow artery, there are a lot of things happen at the very same time. It's not just the piping narrow and cause decreased blood flow. When the artery narrow to a certain degree, usually around 50%, the study have shown that the volume of blood flow through that artery will drop. Now, when people have a certain narrowing, mechanically, there are something follow that. People who have narrow artery, they tend to get narrow quicker than people who did not have a narrow artery, because of when you have narrow artery, the blood flow to have a shearing force, and have a shearing force, it further damage artery further away from the location of narrowing. So these people, they exposed to narrow artery, they have more risk of narrowing. So how does it work? At first, we identify the location where the narrowing is. If we're talking about the portion of the neck alone, once we identify and if we decide that patient is a good candidate to open it up, we bring them to the cardiac cath lab, and we further precisely identify the location by injecting the dye. And after that, we put a small pipe through the groin and thread it to near the location of narrowing. The first step, when we get to that point, is the first step after we get to that point is we put an equipment we call embolic protection device. It behaves like an umbrella. This umbrella has small tiny hole around it. The hole is big enough for the red blood cell and white blood cell, the blood component, to go through, but it's small enough to filter a very large plaque. Okay, so we put this equipment above the location that we want to fix, and after that, we put the balloon across the location that we want to fix, and then dilate the balloon gently. So you have narrowing artery, you dilate it up. What happens is you crack the plaque, and this plaque, when it cracks, it fall apart.
And it's rinsed out of
and it's going to the head. But we did put an equipment up there to trap this thing to start with. Obviously, there's very small plaque, very, very tiny one, will go through that hole. But what we are doing now is try to trap the big one. And once we trap the big one, during the time that we do that, when we open the artery up to the size that we satisfy, we take the balloon out, we put another piece of metal that behave as a scaffold, thread it up, and park. It's like parking a car. Park in a cover location that we just cracked it apart. For example, if you want to imagine that you scrape the wall, you scrape the narrow wall out, and the wall is full of rough surface, and you put a scaffold, a brand new wallpaper. But this wallpaper is strong enough to preventing it collapse, and the wallpaper itself promote the smooth growing back of the so-called normal cell. And after that, after we put that scaffold in, we just remove. There is some technique that we can remove the embolic protection, the umbrella out, and that is end of the procedure.